Okay, I'm Dr. Mark Musso. I'm a dentist in Dallas, and been doing this for general dentistry about 25 years. I deal with a lot of kids who have sleep issues and airway issues. And I'm going to talk today about how important it is to have the right team to be successful with this. This is my patient, Matthew. He's dying. He's not getting any air. What if he does this all night long? How do you think he's going to feel? You know how we feel when we don't get any air for one night. What if he does this for a week or a month? He's going to go to school. He's not going to be able to think. He's going to have attention problems. He's going to wake up groggy, just not feeling good. What if he does this for his whole life? You know, he's going to run into problems with sleep apnea if he doesn't already have it. He's going to run into health issues and all the comorbidities that go along with sleep apnea. This is an epidemic, and we are not addressing it like we should. And it needs to be identified first and then figured out how to take care of it. I want to talk about common versus normal. His mom showed this video to the pediatrician, and she said, it's normal, he'll grow out of it. Normal. So I think we confuse common with normal. It's common because there's a lot of kids suffering, and some people don't know how to handle it. So I want to make that distinction between normal and common. And we just take, their advice and they say it's normal, you'll grow out of it, and you gotta dig deeper. You gotta keep thinking. It's not normal to grind your teeth at night. It's not normal to snore. It's not normal to wet your bed after 5 years old. And yet we're told this. So I want to tell you a little bit about my story. I'm one of those dentists. This is my dad. He was a dentist. My mom was a hygienist. My brother's Mike is a dentist with me. And so I kind of grew up in this, right? Well, at 10 years old, I was diagnosed with dyslexia, or what they thought that was. And so every day, my dad would come home from work, right, and sit on the couch. He'd make me read to him, and I hated reading. So he would start, as soon as he got seated down, he would actually fall asleep. And he would start snoring. Then he'd make that horrible sound of choking. And I didn't know what that was at that time. I just knew it was my opportunity to get outside and go throw the football with my brother or something, Now I know what I know, and I put everything together. I've been doing a lot of sleep with adults and children, and I know for a fact that my dad died from complications of undiagnosed sleep apnea. And so I started putting it all together again. I thought, I got to check myself, my brothers, my family, my patients, obviously. And so I did my sleep study. I stopped breathing 11 times an hour. It's not a lot to some people, but it's a lot to me. And I didn't think it was bad. I thought I was fine, right? And of course, my wife didn't like it because I kept snoring. And so I got a tap appliance back when, and it helped her, because I didn't snore and she slept well, and it helped me. And I didn't really know the true benefits that I was getting from getting a good night's sleep with good oxygen. Well, I started thinking, okay, I got sleep apnea. My dad, I'm sure, had it. What about my son? This is Z-Dog. This is Zach. Man, we love catching fish out in Texas. So he's a fun kid, loves to enjoy life. He's the kid, though, at night. He's the kid that at night would snore, and he'd grind his teeth horribly. He'd come into my room, in the middle of the night terrors, all that. He'd wet the bed. He'd wake up in the morning and he'd go, Dad, I didn't sleep. And I go, Zach, come on, get up. Don't, I feel bad because I was a bad dad. I was like, get your butt up. We got to go to school. I don't want, none of this. Let's go. And I even, people told me that I needed to get him up since he was wet in the bed, to wake him up in the middle of the night, take him into the bathroom, and let him go to the bathroom. And they said, say an animal name like a giraffe, so they try to remember it for the next day. And How stupid is that? Me waking him up and taking him out of his sleep. So there's a lot of things that I learned along the way and I didn't know, and I was kind of upset with myself for not knowing this. So where it started to really connect the dots is my hygienist, Lori. She's been with me for 12 years. Sweet girl, and she came into my office. I'm on the computer working, measuring for implants, and I love surgery, so I was totally into this. And she goes, "Hey, Dr. Mark, there's a dentist that claims that they can help with bedwetting." And I go, "Lori, say it out loud again. That doesn't make sense at all. We work up here, we don't work down there. So this isn't something that makes sense." And she's like, "Hey, you know what? I'm desperate. I've tried all the pills and everything." And I said, "Lori, you're right. You're a mom. I get it. You're gonna make this happen. I love your passion for this. And so go. I'm sorry I can't help you because I really don't know anything about it." And she left and she went. So she made an appointment, went to that other dentist. It hurt my feelings. I was like, man, why don't I know anything about this? Is it real? And so I didn't really, believe it could happen. And 3 weeks later, little Hannah stopped wetting the bed in 3 weeks. 3 weeks. And I was like, typical dentist, we don't, you got to, hey, prove it to me really, let me see. I know I believe her, but I was like, I don't still get it. Meanwhile, my younger brother, Bobby, he's a big boy, he's bigger than me. I finally got him to get a sleep study. Been begging him he's 40 years old. I've been begging him forever to get a sleep study. He gets it. It's 26 times an hour. It's like every other minute he stops breathing. And he doesn't even realize every morning he wakes up how normal he should be feeling. You get coffee and get going, you got to make it work. He didn't realize. He got onto the CPAP, because I just said, that's probably better than an MAD at that time. I didn't have DNA. And he goes, I go, "Bobby, call me in about 3 weeks and let me know how you're doing." And like clockwork, he calls. He goes, "You are not going to believe this, Mark." He goes, I go, "Bobby, I get it. I see all my patients. They get oxygen. It makes sense. You can get oxygen. You're going to breathe well. No, Mark. I stopped wetting the bed. My brother wet the bed for 40 years. 40 years. And he's my little brother. I was in the same room with him growing up, grade school, high school. I saw all this, and I saw what he was going through. It was horrible. And college, got married. How would you like to tell your wife, So those kind of things. He said, he's got such a great attitude. He goes, at one point I just decided that this is my my cross to bear, and I'm gonna take it, and I'll be okay. He texted me yesterday because he knows I'm coming to do this, and he was just like, "Go get him, brother, go get him." So this I've seen it ruin lives and change lives, and I've seen it do it the other way for the good. And so Lori told me to go watch this webinar. And at this point, I was ready to listen. And so I watched this webinar. It was an hour and a half, Ben Moralia's webinar. Man, I watched that once. I watched it another 2 times in a row. I was up all night, worst night of my life. I didn't sleep well at all. But I learned so much, and it all made sense. I was like, this is it, man. This is it. And so since then, this is my passion. This is what I'm doing. I brought it to my office. I said, we're gonna make this office a breathing office. We're gonna make this thing work. It put a lot of money into my pocket. I like to be rewarded for working hard, but this is something that, I'd rather cases like my brother or anybody else than any dollar value. So it's just so rewarding. People all over states are coming to me, and it's just it's something that I love to do. So it's changed the way I've been looking at dentistry. No, I don't look just for a cavity or periodontal disease. We got to do that, right? But man, I'm looking at the big picture. And that's what I encourage. Everybody has to understand this. At a young age, it has to be done. You cannot sit here and wait. And Meg gave I love Meg. This is something that as a child, that could have been changed. So these are things that that we need to start working together. And so my part, it's a team. There's several different teams in my life. My team at my office, behind every good dentist, is a great team. And this is what is making me even more successful is the push from these guys. They're a fun group. I'll tell you what. They're serious when it's time to work, and they like to have fun when it's not. So, but a lot of the moms here have young children. So they see the results that I'm getting every day and the success. And so they're encouraged. And man, when you have that and you have them talking about it, it's getting big. But my problem was it wasn't getting big enough. I was putting out flyers and marketing, and I was doing anything I could. I was coaching and educating the patients in the operatories and everything, and we'd have parent nights where we'd tell them to come. We'd give them a glass of wine and a sandwich or something, and they would. By the time I explained all this, not just the bedwetting, the whole sleep area issue, and by the time I explained it all, they were in. They were all in, and it was just so. It made sense. You don't need to be a doctor. We're trying to overcomplicate this thing. You need oxygen. If you don't breathe well, you don't sleep well. And then all the other things that come along with it just get worse. Growth and development suffers. So I figured I need to find my dream team. I wanted to get the best people working with me. I know I'm not an idiot. I know I need other people to help me get this done. We need chiropractors, ENTs, osteopaths. Myofunctional therapists is one of the most important part of this. They're unrealized how awesome they are and how necessary they are. So I started kind of going out on meeting different people. I'd go to lunch and just say, hey, can I tell you what I'm doing? Let's talk about it, and I'd immediately know if it wasn't going to work. I'd say, okay, well, thanks. Let's have a good day, But if he started talking my way, airway, and we started figuring out that we're on the same page, man, I was like, this is exciting. One of my very first, and actually Dr. Jeff West, I met him for dinner, and he was right away. I knew it, man. I was like, Jeff, let's talk about some things. Just tell me what you know about this and this. And I didn't tell him what I was doing. I just said, tell me about what you're doing. And he explained what he's doing. I said, oh, so it's kind of like this. And he goes, yeah. And we just, boom, it was done. He is one of my big players on my team. So I needed others. And myofunctional therapists, I got a great one. There's not a lot. So I know there might be some in here right now, but this is the field that you need to start looking with. They need our help, and we need their help. So Jeff was he's amazing. He's actually he's here tonight. I'm gonna bring him up for a minute. I want to let y'all meet him, but he was. They don't teach them teeth. They don't teach them he didn't know how many teeth are in the mouth. That's just part of school for them. He didn't know about tongue tie releasing. He didn't know a lot of that stuff. So he and I collaborated and we'd go have a beer and talk and have a blast and talk about everything that we're learned from each other. And it was just amazing to have someone that can do that. That's the kind of relationship you need. And it's not just a professional. This is a great personal relationship. His actually birthday is the exact same day as mine, the same November 10th, 1967. We figured that out one night. But so this is one of the collaborations. He would refer my patients to me, and I'd refer them back to him because we were and we'd sit and talk, and I'd go, hey, Jeff, what do you see here? And it was just so comforting to have someone like that to bounce ideas off. And so Nicholas comes in, and you can see crooked smile, looks like he's super tired. And his mom goes, hey, why is his teeth all messed up, and why he's not sleeping well, and he didn't have a lot of symptoms, but that pretty much. And I said, I started explaining to him, and she goes, oh, well, then why is the twin brother, the identical twin brother, so different? And I go, well, I explained epigenetics to him. And I said, this is what happens. And Nicholas ended up actually having an airway issue earlier on, had tonsils and adenoids removed before I got to see him, but he was still mouth breathing. Epigenetics took its toll on him, and he couldn't close his mouth, and just the tongue didn't work. There was no myofunctional therapy. So I got myofunctional therapists in on it, and actually we didn't have to go to Dr. West on this one, but we started working real well. In just a little time, this is Matthew, his brother. This is Nicholas. These are identical twins. There's all. I can explain epigenetics like this. Dr. Singh does it way over my head, but this is how I understand it. So when we put him through, some removable appliances, this is him 2016, and then 2018. Look at the change. We're not finished yet, but look at the change by just putting him into some removable appliances, doing a lot of myofunctional therapy, getting all the people in the right place. And if you look down at his height over here, two bars over the blue, he's actually gotten back up in height to his brother. Earlier, you could see it was a little bit different, but he grew back up to where his genetic potential was, and he actually went a little more. He's a little more than his brother. So let's see if I forgot if I have those together. So this is Matthew. So I love it. Never give up. I'm not gonna. That's part of this thing. That's why I'm here today. I don't want to stop. I want to keep yelling this message out, and I feel like I need a bigger stage all the time, and this is giving me a little bigger stage. I want bigger. I want Today Show. I want to be on the Today Show. I want us to know. I want people to hear it that haven't heard it, and even dentists haven't heard it. Okay, I got to get going real quick. So I went on the news, and we had Dr. West and I got on the news, and we had Dr. West, will you come on up here and let me just kind of finish this with you here. Amazing results, man. But they came in and it was I got like 30 calls. We talked about bedwetting. I figured that was the low-hanging fruit, and so I figured this is my buddy right here. So let me go through a little bit of this, and then so we said, this is going to be something that we can just kind of tap into this market. There's 20% of people that are still wet in the bed, and people don't talk about it. And when they came in, they were just amazed. And actually, some of the dads would be mad. They'd say, "What am I doing in here in a dental office talking about bedwetting?" And I said, "I'm glad you asked. Let's talk about it. I want to talk." So I got an opportunity to talk to them about airway. And I kidded with Jeff, and I was like, "Well, you can't spell dentist without an ENT, right?" So we need each other. This is a team that we need to go with this. Okay. Then Jeff and I also worked on this. This is Ava.
My name is Ava, and I am 9 years old. I'm going into 4th grade, and I love playing soccer.
I'm Angela Daigle, and this is my husband, Chris Daigle, and we're Ava's parents. And we found out about Musso Dental through the Good Morning Texas interview. Wetting the bed has had a big impact on Ava. She does not want to go spend the night at a friend's house. We have tried several things with Ava to help her with the bedwetting. Most recently, the thing we've been doing is setting our alarm every couple of hours and getting up.
And then you've got the doctors telling you she'll grow out of it, but we just don't know when.
The very first night that Ava wore the appliance, she did not have an accident.
It worked the very first night and has worked ever since.
The very first night. It's just about getting the mouth closed and the airway working. So this is the one that we worked on the best. This is the one Matthew, you saw earlier. You've already heard this. I'm going to go through it quick. We're going to try to get y'all to lunch soon. So he came in. He's crowded, all kinds of issues here, overjet, overbite, and just he's been through. It's been 3 years almost, and he's no, that's 19. It's been 2 years. So he's come through here. But here's his story. We get him to stop wetting the bed. He was wetting the bed every night. And we got him down to 6 nights a week. Only one night of wetting the bed. And I wasn't happy with it. I wanted more. So heavy myofunctional therapy. We're going through that. I sent him over to Jeff. And Jeff's like, "Oh yeah, let's do that." He needed to take out those tonsils, adenoids. And I said, "Well, let's clip the tongue while we're there." So I asked if I can come watch the surgery. You got to see these guys work. They are amazing. He got in there, and we were talking about how we're going to, release the tongue, and the anesthesiologist was frustrated. She couldn't intubate him. She's like, "I cannot believe this kid's 10 years old, and these tonsils are so big, and no one confronted it. No one talked about it." So I took a picture. I thought it was pretty cool. I love surgery. So that's about 3.5 inches of tissue blocking that airway. Is that ridiculous? And we don't always want to take out tonsils. It's not our favorite thing to do. But this kid, you saw how he's dying. So he did his little project on the mighty tongue, got an A+. He got an A+. He's an amazing kid. He's going to be here actually today, so y'all get to meet him. But this is him sleeping now. Mom was so happy. Just another quick case, just going 2 years of literally just getting myofunctional therapy and appliances and getting her mouth opened up. So my favorite case is this is in 3 months. She went from here to there, just by closing the mouth, getting the tongue in the roof of your mouth, breathing through your nose, and myofunctional therapy and with our appliances. In 3 months, she did that. Here she is, and this is why it's so important. Why would you let something like this go till 12 or go till longer, or don't address it at all? This has to be addressed early. Okay, so you need so many more people on your team, and so I made my dream team's getting better. I kid him. You're Sir Charles Barkley. I'm Michael. So. So we got osteopath, so important, naturopath, chiropractor, myofunctional therapist. Brain balance is an amazing thing that I'm connected with Heather Wells now, and she's talking about how important it is to any retained primitive reflex is a problem for a child. And so there's so many things we have to learn that we don't have all the answers right now, but we're going to get it, and you need a team to be part of that. So I put there we are. All right, then I have another team. I have another team that is my dentist buddies, and we're on a WhatsApp talk all the time. And every day I talk to them, and they're encouraging me. We're talking best practices. I show them an X-ray. Hey, what do y'all see? You gotta get your buddies, and it's not competition. One of my buddies is literally a half a mile down the road, and we've learned so much from each other, and we're buddies. You've got to break that old model, and we get together once a year. We'll have they came over to my office, and I sat down and showed them. I had a naturopath. I had all those people talk to them and educated them on there. One of my buddies from this group is here right now. So I wanted to ask you and get your point on what you see and how this went for you.
Yeah, it's a great, like I said, a collaboration back and forth in adults and in children. Frequently, if I see a kiddo and I work with their allergies and do different ways, try to open up the airway, but always have another option, especially when we get to the point of talking about surgical options. It's always nice to see that I'm not trying to take their kid off to surgery, that there's other options besides just the tonsils or adenoids. And also, from an adult standpoint, obviously with sleep apnea, so many people aren't going to do CPAP, and so he probably sends me more kids, and I probably send him more adults, right. But we send people back and forth, and it's great because like the lady said, that had a horrible experience. By the way, ENT did not do her turbinates, by the way, officially. We do turbinates all the time, and they over-resect it, obviously, but just be in collaboration, just having all the different options. And some patients are not going to need me or him. Everybody's different. It's a dynamic that not one thing is going to fix everybody. And the other thing too that I think is real important, and I talked to Dr. Griffin earlier about it, is UARS, which if you want to talk to your ENT guys, talk about TMJ. I used to always say us ENT guys, people come in with TMJ stuff. TMD, whatever, sorry, that just drives us crazy because they come in with ear pain and they're miserable and they have ringing and all these different symptoms. Of course, to me, this is me and Mark's opinion and maybe some of you guys, if they're bruxing, they're not sleeping good. And so it's always, so I used to think it was always TMJ. Really, now I know it's sleep. So you ask an ENT guy, they always have at least one good ENT guy they send to. Well, now I have a bunch of good dentists that we send to. So talking to your ENT guy, tell them you want to see their TMJ patients, but really they're sleep patients. They may not realize it's sleep, but that's usually what it is most of the time, at least in our opinion. Because those TMJ people, we can't fix them because it's an airway issue, it's a sleep issue, and I can't fix that always. The other thing was with Dr. Griffin, you noticed all the symptoms she had. A couple of people back, she was miserable, she was depressed, had all these symptoms. Her sleep study, she didn't have apnea, did she? She didn't have apnea. So also UARS, to me, that's key. That's disruptive sleep without the apnea. They're still not getting that restorative sleep. And you do a home sleep study, if it doesn't have the breakdown of the sleep cycles, if it just says apnea or no apnea, you're going to miss that. It's going to be normal. And the people, and you see that all the time. People said, yeah, 5 years ago I was miserable. Sleep study said no evidence of apnea. There was not very much desaturation, or maybe in the 80s. And those people, you saw how miserable Tara was. She was miserable, and she basically probably had, if she would have had a home sleep study, it would have said it was basically normal. So to me, the kid, and those are the people you're going to see in your office all the time too. So those are tougher to pick up on. I know some of the newer sleep studies do break down the cycles of the sleep a little bit better. And then of course, in-lab studies actually show the stages of sleep. If you see that stage 3 sleep and it's 0, 5, 10%, should be about 30% for most adults. If they're not getting stage 3 sleep, I don't care if they're holding their breath 1 or 2 seconds like Tara did, or 10 or 20 seconds like I do, because I've obviously got a weight issue. It doesn't matter how long you hold your breath for. If you're disruptive sleep, it's stressful on the body, it creates inflammation, and that's going to a lot of times end up affecting these people in a lot of ways, like that poor lady. So the key, if you work with ENT guys, is tell them you want to be their TMJ guy, but really you're their sleep guy person. So
Nice, thank you, Jay.
it's nice collaboration.
So one of my life coaches gave me, that I've learned from this, and I want you all to go back and start thinking about this, learning whatever you can do. We want to prevent Matthews and my brother and Meg. We want to stop this early. And one of my life coaches, Gary Cady, taught me if you change the way you look at things, the things that you look at will change. Thank you, guys.
Thank you, Dr. Musso.